Cystic fibrosis transmembrane conductance is a plasma membrane protein which is responsible for the transformation of ions out of the cell. However, in this case, cystic fibrosis is a mutation which halts the process and causing an accumulation of water, later becoming thick mucus. The signs and symptoms of cystic fibrosis is pain in the abdomen because of mucus blocking tubes that carry digestive enzymes to the abdomen area. Another one is cough, which could be chronic with blood or phlegm because of the buildup of mucus in the lungs. Gastro problems, example diarrhea, heartburn, severe constipation because of the mucus blocking tubes to carry enzymes which allow nutrients to be absorbed. Respiratory problems can occur, which is an example of shortness in breath, wheezing because of the mucus buildup which blocks the pathway of air to and from the lungs. And whole body fatigue or inability to exercise because of the mucus trapping oxygen, not allowing it to spread through the body, which doesn't allow your muscles to function after a very short period of exercise. The location of cystic fibrosis is on the 7th human chromosome, which is a deletion of a pair of ATC, which is a nitrogen base. The mutation causes an excess amount of mucus in the lungs, causing oxygen to travel out of the lungs at a slower rate. Casein enzymes are the proteins that create mucus, which have the deletion causing cystic fibrosis. Cystic fibrosis is an example of a recessive disease. That means that the person must have a mutation in both copies of the CF gene to have CF. If someone has a mutation in only one copy of the CF gene and the other copy is normal, he or she does not have CF. All states screen newborns for CF using a genetic test or blood test. The genetic test shows whether a newborn has a faulty CFTR gene. The blood test shows whether a woman's newborn pancreas is working properly. For adults and children, sweat tests and x-rays of the chest. This test creates a picture of the structure in your chest, such as your lung, heart, and blood vessels. A chest x-ray can show whether your lungs are inflamed or scarred, or whether they trapped air, and sweat tests for this test. The doctor triggers sweating on a small patch of skin, arm or leg. He or she rubs the skin with a sweat-producing chemical and then uses an electrode to provide a mild electric current. This may cause a tingling or warm feeling. The sweat is collected on a pad or paper and then analysed. The sweat test is usually done twice. High salt level confirm a diagnosis of CF. Treatment. Cystic fibrosis has no long-term cure. However, there are medications and strategies to ease symptoms. An example of these are preventing and controlling lung infections by treating with antibiotics, chest physical therapy, which is loosening and removing thick, sticky mucus from the lungs by another person clapping or vibrating on the chest of the patient so that it loosens the mucus and can be coughed out through the mouth. The limitations that the treatment have is that there is no cure, so every treatment, example the chest physical therapy, is that it is only lasts for a certain amount of time before the process has to be repeated. Overall, for each treatment, it only lasts for a limited amount of time. No treatment will cure it for the rest of their lives. Another example is taking antibiotics and penicillin. The treatment is ongoing and works, but it is the consistent daily use of the drugs that can end up with the bacteria mutating, becoming immune to the antibiotics and penicillin. The biotechnology. Kalydeco is a drug which was tested in 2010 on two sisters which had cystic fibrosis. The drug turned out to work and give them their normal lives back. The drug fixes the deletion of the ATC proteins, giving the cell the right and normal information. The drug is not yet safe on children under the age of 2, but does work for the age of 37, where the most cystic fibrosis patients die. Cystic fibrosis, as you know, doesn't have a cure for all ages and types. The funding for the disease can help many patients live a normal life. All the medication that is around now only lasts for a short amount of time, making it a daily habit for those to make medication and go through their therapies. Funding can help scientists make a cure and give suffering patients a chance to beat cystic fibrosis.